Have you ever thought about using a toothpaste dispenser? I'm Joyce the Dentist, and I'm passionate about helping people avoid dental problems before they start. As a dentist, I know that almost every dental concern is preventable, and the best ways to prevent them are with amazing home care. A basic toothbrush, floss, and fluoride toothpaste are your top 3 must-haves for effective home care. But if you're someone who struggles with your manual dexterity, maybe you have arthritis, carpal tunnel syndrome, or a child that struggles with their hand coordination, a toothpaste dispenser can be extremely helpful. In fact, some toothpaste dispensers even give you the proper dose of fluoride to prevent younger family members from overdoing it. For example, this prescription fluoride one from Elevate pumps out the exact amount each time. Perfect. And since it's so precise, this is also a great way to know how long a toothpaste should last you if you use it both morning and night. This one is exactly 6 months. Toothpaste dispensers come in all shapes and sizes. Some are automatic and others are manual squeezers that help you get every last drop of toothpaste out of a tube. First, we have the hands-free automatic toothpaste dispensers. These are devices that you typically mount to the wall next to your bathroom sink. These toothpaste dispensers usually have batteries and some type of sensor to tell when there's a toothbrush underneath them. When you put the toothbrush in the dispensing zone, the motion sensor triggers the dispenser to squish or squeeze out a small amount of toothpaste. They're the most hands-off option that exists. If you have severe arthritis in your hands or any type of dexterity issue, this is the type of toothpaste dispenser that you want. Next is a similar toothpaste dispenser that's also wall-mounted but does not use electronics. It's manual. These designs usually have some sort of button or a little lever that you press your toothbrush head against, and it squirts out exactly how much toothpaste you want to use. No more, no less. You just screw your tube of toothpaste down inside of the dispenser, and each time you press on the lever, it squeezes some of the toothpaste out onto the tube. It only works when you press the end of your toothbrush head onto the lever. This type of toothpaste dispenser is low fuss because you don't have to worry about batteries or recharging anything. The only potential issue is making sure that you can have a firm enough grip on your toothbrush handle to press the lever and squirt out the toothpaste. Most adults and children, whether they have dexterity issues or not, can use these toothpaste dispensers just fine. And finally, we have manual tube squeezers, which you slide up the tube with your hand to physically squish out however much toothpaste you want. Some of these manual designs have small turn keys that you turn to squeeze out the toothpaste. This gives you plenty of control over how much toothpaste comes out. The one downside of manual toothpaste squeezers is that they can sometimes be a little more challenging to use, especially if you have dexterity issues because of the design. It can be hard for some people to turn the knob, especially if it's a child or someone with arthritis in their hands. Depending on the design that you pick, there's also a chance of possibly squeezing too much of that toothpaste out of the toothpaste tube. But if you want the cheapest option out there and like to get the most out of every tube of toothpaste that you buy, these devices will help you get almost every ounce out of the tube. I really like toothpaste dispensers for 2 reasons. One, they help make sure people are using the correct amount of toothpaste. If you have kids in your family who are constantly going through toothpaste because they're using too much, this investment will help you solve that problem. It cuts waste. Remember, you don't need that much toothpaste. Experts recommend that people only use a pea-sized amount of fluoride toothpaste twice a day. Second, these tools are extremely helpful for older family members or people with special needs who have limited mobility. It allows them to function independently, even if they have bad joints or poor muscle control. Better yet, you can pair the dispenser with an electric toothbrush and almost completely eliminate the extra motion used while brushing someone's teeth. Just hold the brush in place and let it do all the work for you. So if you have trouble getting the toothpaste out of the tube, your kids are always using too much toothpaste, or you find that you're just trying to control how messy the bathroom gets, investing in a toothpaste dispenser is a tiny upgrade that can really make a huge difference. Smile smarter, everyone. I'm Dr. Joyce. I'll see you next time. Bye.